Welcome back to my channel. Without further ado, let's deep dive into the topic. In this video, I'm gonna talk regarding reading subtest part B. The most complaining and the most challenging part is reading part B and C. So I'm gonna talk regarding part B in this video, and I will look into part C, how to crack it in the later video. In part B, you are going to face 6 individual multiple choice questions with a paragraph comes with 3 multiple choice options. So you need to select the best which you feel that is right. I just made some points here so I do not miss any points while explaining to you. I just come back from night shift. I'm feeling so sleepy. You can look at my eye bags. Okay, the first thing why part B is very much challenging, because after in the reading subtest, after writing the part A, you will get 45 minutes to clear part B and C. In that time, you need to divide for how many minutes you are going to take for part B and how many minutes you are going to get to complete the part C. So maximum time you need to complete it in 12 minutes. That would be best. If you complete it around 10 to 12 minutes these questions, then you will be having more than 30 minutes to attend the next 16 questions, I think. So each questions will be having like average 2 minutes it will take. So get ready, we'll move on to the things. I would like to tell you that after telling you some tips and tricks, I'm gonna discuss with you total 9 questions, some simple context questions and answer. The next 3 medium, moderate one, and the next 3 bit challenging one. I will show you the context and how to answer it, so it will clear your mind. If you are having any doubt, how to clear the wrong options to eliminate it. Okay, so in the part B, if they give you the question, first you identify whether it is a memo, guideline, email, whether they are giving you instructions what to do, or it is giving you advice what could be done, suggestion. So understand this one. And the next point, do not try to read each and every word and line. Try to understand. You are not going to, this is not some nursing exam that you study this question, understand the context, and you need to go sit in the exam hall and write. Do not try to buy it. Remember the lines. Just read once, understand it, and leave it. That's it. Simple. If you try to make it complex, it will be keep going complex. So if you have a solution for a problem, always choose the simplest solution. That's why don't try to make it complex, being overwhelmed. Okay, and the next one, the main word, keywords. In part B, part C, wherever it is in OET, keywords are very important. It's like the question and the context is a lock, and there will be keywords, the clue, which is telling this is the key to unlock this locker. So you need to search for those keys. Okay, I will explain you what are the keywords, how to find it out. And the next one, okay, you got the question paper, you got the time, everything set. Then what to do next? Before you jump into the context and question and options, first only read the question 1 time or 2 times, if you need 3 times. Understand the question. Usually in part B, the questions would be very simple to understand. So read the question 2 times, understand it, then directly jump into the context. Read the context, simple 1 time from top down, then go to the question, then see the option. At least one option you can eliminate, like by closing your eyes. So the next 2 options you might face difficulty to select which option is correct. At that time, just go back to the context again, read it, and try to compare which option would be the best and best one matching to the context. So if you find that, just tick it, move on to the next question. Don't try to overspend time on a single question. Okay, just if you don't get, tick it, guess, move on to the next, and at the end of the subtest, if you get time, come back, revise, and you can reconsider your options. Okay, next we are moving into identify the keywords in the answer choices. Look for keywords in option A, B, and C, and see which one aligns best with the information in the text, as I said previously. And the main thing you have to be very careful, very cautious, is the exact phrases from the text. These can be traps, means they are trying to trick you. They are trying to trick the candidates, whether the candidate can understand the meaning of the context. So they are trying to trick you by giving the question context and the option with like exact words, but it doesn't mean the same. So it doesn't mean the exact right option answer, but it looks like, okay, the question is like this, and I can see the same words in the question, in the context, and in the option. So I'm not understanding which option is correct. So this might be the one. Let me select this one because they all look familiar. So let me choose this option. No, that is very wrong, and sometimes that could make you tricky by thinking, okay, question is simple, option is simple, context is simple. Are they trying to trick me, or is this the simple one? So you really need to understand. Sometimes really they will give you very easy context, question, and options. You will get it. Sometimes you will get tricked by yourself, by your overthinking. So don't do overthinking. Just make it simple. Read question, read the context, read option, eliminate the wrong answers, then you will left with the correct option which you think that is right. Okay, then we are going to look for synonyms and paraphrasing. The answer may not use the exact words, but they may use different synonyms or the paraphrasing word which can mean the correct answer to the question. So try to look out for that. Don't worry, we'll discuss about some of the part B questions later. And as I said, don't get stuck. If you get stuck, you are going to lose time in the next question. In the OET exam, time management is very, very vital for you to clear your exam. I hope you understand. Okay, because when I gave my first attempt, that was the main mistake I did it. So you don't do it. Okay, let's have a look. Question. So we are directly going to jump to the question. What is the main purpose of this mail? Understand what is the main purpose of this mail? So you were working in a hospital, you got a mail which contains some information to deliver it to you, to the team, or to the institution, to anybody, from individual to institution. So understand the question. You got a mail which is saying something to you. This is simple. Now let's jump to the text. Let's read the text, each word, and understand each word meaning. Please be advised that starting next month, the hospital will implement a new scheduling system to optimize staff coverage. All employees will now need to submit their availability by the 15th of each month. Any requests for schedule changes must be made at least 1 week in advance to ensure proper staffing levels. Failure to comply with these deadlines may result in reduced availability. So in this mail, they are discussing regarding how they are going to manage the staff availability for future schedule, like a duty roster. It is a duty roster. and what are the changes they are doing. So now we'll going to the option A. So you select the option which is right, which is wrong. This is very simple. Obviously you should score out of out. Option A, to inform staff about the consequences of missing work. You may think that they said in the last line, it says failure to comply with these deadlines may result in reduced availability. So you may think that they are saying the consequences. What are the consequences? Consequences means something negative. Failure means something negative. So this might be the option. Now, even though if you get the answer option correct, don't stop reading the next options. You should complete all the options. Option B, to outline changes to staff scheduling procedures. So understand, to outline means explain. To explain changes to the staff scheduling procedures. Okay, this is the answer option because they are discussing regarding the changes in the scheduling procedures and they are explaining to the staff. So we got the answer, but we still continue to read the option C, to notify employees about upcoming mandatory training sessions. Here, the first two words, to notify employees, that is correct. About upcoming, that is correct. But mandatory training sessions, nowhere they mentioned they are discussing about mandatory training sessions. Mandatory means compulsory. Training means the training to the staff. Sessions means same. So they are not discussing about giving some compulsory training sessions to the staff. So when you are reading question, you should understand this is the simple and very effective thing which I adopted is there are individual meaning for each word. So understand each words, it has its own meaning. So if you understand each words, you will get the option of sir like easily. You will get 1 point. This is easy. You should get out of what? The first three, next three, and next three. It will be like from easy, moderate, be it challenging. It is not so much challenging. Okay. Follow the same technique. Jump into the question. What should a staff member do if they find an error in patient's record? Let's understand the question. What should a staff member do if they find an error in patient's record? So I'm a nurse, I'm working in hospital and I find some error. It can be medication error or documentation error. I found it. So what I should do? That's what it says. The text is saying about what you should do. Let's read. All healthcare professionals must ensure that patients' records are updated immediately after consultations. The accuracy of these records is critical for ongoing patient care and compliance with healthcare regulations. Any discrepancies found in patient documentation must be reported to the EMR support team within 24 hours for correction. A repeated failure to update records promptly may result in disciplinary action. So we understand the question. Text option, we'll see the answer. Option A, inform the patient about the discrepancy. Do you think they are telling us to inform to the patient that what has happened? Is it? No, that is not. So we'll move to the next option. We'll see option C, correct the record themselves without delay. So if we understand the text, they say correct the record without delay but not by themselves. So it says any discrepancies found in patient documentation must be reported to the EMR support team within 24 hours for correction. So we'll move on to the option B, report the issue to the EMR support team. So if I find any errors in patient documentation, what I'm going to do, I'm going to report to the EMR team within 24 hours for correction. That is answer. Pause the video, understand it, and you can move to the next one. Okay, next move to the sample question number 3, the easy questions one. According to the text, what should staff do if they are unable to resolve a patient's complaint immediately? I'm a nurse. I'm in my department. So some patient came with their complaints. So if I couldn't resolve their concerns, what I should do immediately? Simple. You are dealing with these things in hospital day-to-day basis. So it is very simple, guys. Don't make it complex. It is really simple. Option A, apologize. No, we need to go to the context here. When a patient expresses dissatisfaction, it is essential to acknowledge their concerns promptly. Begin by listening attentively and documenting the issue in the complaint log. If the matter cannot be resolved immediately, escalate it to the patient relations officer for further actions. Always maintain a professional and empathetic tone throughout the interaction to ensure the patient concerns are taken seriously. So think which option is correct. We move to the option. Option A, apologize to the patient and end the conversation. First thing, this is a general thing, we need to apologize to the patient if there is any problem caused from the medical or nursing team. That is apologize, but and then they say apologize to the patient and then the conversation. So if patient is telling some complaints to me, I say like, oh sorry, we'll inform to the medical team, don't worry, I got some work, I need to go. No, that is not the correct thing. So patient concerns and safety is very much important in every country, every institution in hospital. So that is the main aim of OET, to check whether a nurse is safe to practice in their country to treat their patients. And then option B, escalate the issue to the patient relations officer. So if we find any unresolved patient's complaint immediately, do we need to inform to the patient relations officer? Yes, we need to. In the third line, they said, if the matter cannot be resolved immediately, escalate it to the patient's relations officer for further action. It is straight, simple answers. No need of explanation. Option C, offer the patient a refund or compensation. There's no way they are mentioning that offering patient a refund or compensation. That's, if you get this kind of answers, do not overthink, just select the answer and go, you will get one point. You should get 9 out of 9 in this before listening to me. Okay, understand the question. What should a staff member do if they accidentally access a patient's information? So you know, guys, that we professionals, registered professionals, we are authorized to view patients' information, their record. We can check only if it is 100% necessary for us to go in through their records, because we need to respect their confidentiality and privacy. So to maintain compliance with patients' privacy laws, all staff members must adhere strictly to facilities confidentiality protocols. Staff should only access patient information related to their duties. Unauthorized access to patient records is strictly prohibited and will be subject to disciplinary action, including possible termination. Any breach of confidentiality must be reported immediately to compliance officer, regardless of intent or severity. These measures are in place to protect both patients and the institution. So which one is the key word here? Regardless of intent or severity. Intent means what? Intention. Severity means severe. So by accessing the patient's information, does it cause big problem or any small thing? It doesn't matter, the severity. And the intent is intention, whether it is purposefully or by, instead of checking other patient's information, you check the other patient's record. So that is intention, purpose, and the question says which are not authorized to view. So we almost got the answer. Option A, log out immediately and ignore the incident if unintentional. So by accidentally you saw the patient record and like log out, I did not do anything, finish. So are you supposed to do that? No. If you do like that, that means you are not a safe nurse to practice nursing. Option B, report the breach to the compliance officer without delay. Report means we are reporting to some individuals. Breach means breaking in to the compliance officer without delay. Compliance means adherence to follow rules and regulation. Option C, delete the accessed information from the system. Very smart, huh? Delete the access information from the system which you had accessed. Now, so we are easily eliminate option A and option C. So we left with option B, report to the officer without delay. That's what in the question it says. Third line, patient record is strictly prohibited and will be subject to disciplinary action. Any breach of confidentiality must be reported immediately to the compliance officer. Very easy. Next, question number 5. It is getting so long video, but I'm trying to explain you so you will get idea to crack your questions. And if you have any questions or trying to understand why this option is correct, if you have any doubt, just send me screenshot or share with me. So if I get some time, I'll try to explain you why this option is correct and how to understand, analyze the question and find out the keywords to get it. Okay, I know you probably have many questions, doubts why this option is correct, and you may feel introvert, shyness to ask your tutor where you are paying them to make you understand, but being shy, you're not asking them. Now don't, please, you're paying exam fees is 35,000 plus. Don't be shy, ask them. You're paying them to make you understand. Okay, question. According to the guideline, when is it necessary to change gloves? Context. Proper use of PPE, personal protective equipment, is mandatory. Mandatory means compulsory for all healthcare procedure to ensure the safety of both staff and patients. 100%. Disposable gloves should be changed between patient to prevent cross contamination. However, gloves must also be changed if they become visibly soiled. Visibly soiled means if the gloves is having any bodily fluids, blood, urine, these are bodily fluids, anything if it is looked soiled, soiled means dirty, we need to change it. Or visibly soiled or compromised during a procedure. Compromised means it compromised its safety. Maybe the glove break down, tore apart, anything punctured. So that is not safe to the patient and to you, to yourself. So at that time you need to change the gloves. Failure to replace PPE when necessary could result in increased infection risk. All staff are reminded to complete the PPE compliance training by end of the month to stay updated on best practices. So it is saying we need to change the gloves when it is soiled, when it is compromised, and the staff must every month undergo training session to get updated on how to prevent infection risk. Option A, only after completing a procedure. Did they say only after completing a procedure? No. In between the procedure, what if you exposed, compromised or visible? Option A is wrong. Option B, if gloves are visibly soiled or compromised. Simple. I'm trying to get more complex one. It is like kids one. But why I choose this context question and option, because to make you understand for the beginners how to get the keywords and understand each and every words in the meaning. And option C, at the start of every shift. So it says every shift we need to, in the beginning we wear, until we complete our shift we will be wearing it with every patient, from patient A to patient B to patient C, whether it is soiled, compromised, anything, don't care about patient safety, infection risk, just wear it. If they do, disciplinary action and possibly termination. Question number 6. What should staff do if they notice the medication stock levels are below the required threshold? Go to the text. Effective inventory management is essential to ensure that medications are always available when needed. So we need to make sure that medications are always available when we need it to the patient. Staff must perform a full stock audit at the end of each month and report any discrepancies to the inventory manager. If there's any problem, we need to inform to the inventory manager. Inventory means the stocks which is required. The inventory means the supplies which is required for a unit to run smoothly. That is known as inventory. Inventory manager means those who manage the inventories. Expired medication should be removed from the shelves immediately and prevent accidental dispensing. Dispensing means you take the tablets, put it in a pot and give to the patient. That is what known as dispensing. Additionally, when stock levels falls below minimum threshold, an automatic restock order will be generated. However, manual orders may still be placed if the system fails to trigger an order in time. So this however is a keyword. So it is saying when the stock levels comes below the threshold level, so it will send an automatic message that medication is coming down, you need to order it. But however, you need to do it by manually if it failed to trigger to send a message. Option A, wait for the automatic restock order to be generated. Delete it. Option B, place a manual order if the system fails to generate one. Okay, we'll keep it aside. Option C, ignore it and proceed with the next task. So you find medication is not, that's not my task. I'll move on to the next job. I got cannulation, medications, got many things, I don't care. No, that is not the right thing. So we eliminate option C and option A. So we left with option B, place a manual order if the system fails to generate one. So as we discussed in the last line, if it fails to send a message, you need to do it manually by contacting with a manager through the telephone or directly face to face in person. Okay, this one is little bit more challenging. That's it. Simple but bit challenging. Means challenging means they are not going to do anything. They are going to make the words, the paraphrases, make it like challenging words that you never heard in day-to-day basis. So you feel like something big question it is, I don't know, don't get panic. Option A, what should a staff member do if they are unsure whether a medication incident qualifies as an error? Understand the question. What should a staff member do if they are unsure? Unsure means they are in doubt whether a medication incident qualifies as an error. Medication incident means like which incident related to medication, you may say it as medication error. What's medication error? Sometimes instead of giving pan 40 mg, you may give pantoprazole 80 mg, or you may get confused with look-alike, sound-alike drug. You may error with the drug dose, drug name, anything can be. So those are known as medication error. So we'll go to the text. Effective immediately means from today. All healthcare staff are required to report any medication errors within 12 hours of the incident. So in the beginning only they say any error happens, it has to be reported to within 12 hours. Regardless of severity, it is how simple, tiny mistake or big mistake, whether it caused a problem to the patient's health or it didn't bother anything at all, still it has to be reported. This change aim 2. This change aims to enhance patient safety by allowing timely investigation and corrective action. If a staff member is uncertain, and the question was unsure. Uncertain and unsure, see the familiarity. It is the different phrases, but it is giving this exact meaning. So it says if a staff member is uncertain whether an incident qualifies as an reportable error, they must consult the head of pharmacy before reporting the deadline. Any delays in reporting may result in disciplinary action. The updated reporting guidelines are accessible via the hospital's internal portal. We already got the answer in the third line and fourth line, but we need to complete the text. I'm trying to repeat it again and again to make you understand. That's it. I know the video is getting longer, but if you want to clear exam, understand the pattern, you need to give your time. Option A, wait until the end of their shift to decide. This is completely wrong option. It never said wait until your shift complete to decide whether it is a reportable incident or not. So wrong, because it has to be reported within 12 hours. Option B, report the incident within 12 hours regardless. So whatever happens, we have to report it within 12 hours. It is there in the text. It is there. You may get confused. So keep the option B separate. Option A, eliminate. Option B, keep it, because it's somewhere in the text it says it has to be reported within 12 hours, otherwise you will meet the disciplinary action. Option C, consult the head of pharmacology before the reporting deadline. So they mentioned there, if a staff is uncertain regarding the incident, they must consult the head of pharmacology before the reporting deadline. As it is there given, so that is the correct answer. So we'll see the option D, refer to the guidelines after the incident has been resolved. Nowhere they said like after the incident resolved you go to the guidelines, understand that one. Never, they didn't say that one. So remove it. Question number 8, what action should a nurse take if a patient is confused about their discharge instruction? So patient is getting discharged today, but they are having some doubts. So what should a nurse do? Simple. Day to day, what we do, we try to explain to the patient. Otherwise, we will ask the medical staff member to have a word with the patient to resolve their concerns. We know this. So we'll see the text. To ensure a smooth discharge process, all nurses must complete the patient's discharge checklist before the scheduled discharge time. There are a discharge checklist which we need to complete it, like whether the discharge letter is ready, medications are ready, is there any instructions, advice need to give to the patient, is everything done, is cannula is removed. These are the checklists we need to complete it. This includes confirming that the patient understands their medication regimen and follow-up appointments. If a patient expresses confusion or uncertainty about their instruction, here it is related to the question. If a patient is confused about the discharge instruction, so that's what the question, and here it is saying patient expresses confusion or uncertainty about their instructions, the nurse must notify the attending physician for further clarification. So they are saying the nurse should inform to the doctor who is looking after the patient to clear their doubts for further clarification. We got the answer, but we'll complete it. The discharge checklist must be signed by the nurse and filed in the patient's record before the patient leaves the ward. Failure to complete the checklist may result in delays or complication in patient care. We got the question. We'll see the option. Proceed with the discharge and advise the patient to follow up later. So they are saying whether the patient is having doubt or uncertain regarding some things, you don't bother about that. You do the discharge and tell the patient to follow up it later because you are busy. That option is wrong. Eliminate it. Option B, Review the instructions with the patient until they confirm understanding. So you go to the patient, review the instructions, try to explain them in a different way until patient say, okay, I understand this, thank you. Okay, it sounds somewhere to the answer option. We'll keep it aside. Option B. Option C. Notify the attending physician to clarify the instruction. Got the answer. Simple. Here it is in text. Option D. But need to see the option D. Why option D is not right? Option D. Document the patient's confusion and proceed with discharge. So it is saying, okay, patient got some confusion, document it and do the discharge. No, nowhere it says do that. It says to inform to the attending physician to clear their doubt. Okay, the last option, guys. Oh my god, whooping 40 minutes plus. Question number 9. If a staff member forgets to wear personal protective gear while entering an affected ward, what is the most appropriate action? Text. During an outbreak. Outbreak means what? Like sudden infection diseases is like pandemic or epidemic. Okay, just like in COVID. So we all know that. COVID outbreak, if it happens, so infection ward, how you need to enter. Option O. During an outbreak, all healthcare personnel must follow enhanced infection control protocols. This includes using full protective gear, sanitizing hands before and after each patient interaction, and restricting access to affected wards. If a healthcare worker shows any symptoms related to outbreak, they must immediately stop patient contact and report to occupational health. Additionally, any breach in protocol must be reported to the infection control team within 2 hours. Continuous monitoring will be conducted to ensure compliance with these measures. We'll have a look into the option A. Immediately leave the ward and report the breach within 2 hours. So does it says option A? Somewhere it feels like okay, somewhere. Option B. Continue with the patient interaction and report the breach afterward. So they are not following the infection protocol and they are talking with the patient like they are not wearing the mask. They're talking with the patient. There is that saying continue talking with the patient interaction and then report it. No, they didn't say. Option B will delete it. Option C. Ensure compliance with protocols in future interaction. So is the saying, okay, now whatever happens, just understand the instructions for future review. No, they are not saying that. Option D. Inform the patient about the lapse in protocol. Are they telling you to inform to the patient about the lapse in protocol that you didn't follow the infection prevention measures? No. So we deleted B, C, D. We'll have with option A, immediately leave the ward and report the breach within 2 hours. Is that correct? So we'll see there. Line number 3. If a healthcare worker shows any symptoms related to the outbreak, they must immediately stop patient contact. So they should stop the patient contact. It says immediately leave the ward. That's it. Okay, that's a long time. Thank you for watching, guys. And if you have any doubts, don't hesitate to put it in the comment section. I will read each and every comments and I understand your perspective. So if you have any questions, doubt, send me a screenshot in Instagram. I'll try to explain it to you because I do not lose anything by explaining it to you. If anyone get useful from me, I'm happy, guys. And one of the candidate, he messaged that brother, I cleared my OET at part B. He got B in all the module. So congratulations, Kiran. Best of luck. Bye. Thank you for watching.